So we're going to start. This is our monthly speaker series or education series that I like to do, being from a long line of teachers. I'm going to talk about medical marijuana or plant-based pain therapy, I guess. Next slide. Today, I'm Dr. Meredith Warner, and I am an orthopedic surgeon in Baton Rouge. I have a private practice in Baton Rouge. I also teach for LSU, so I'm a clinical professor of orthopedics. But in my private practice, I'm able to offer a whole host of different wellness options and naturally based healing methods for people to avoid surgery and avoid chemical drugs is my primary focus, which really takes a lot of effort on the patient's part because I'm trying to empower people to take care of themselves. These are all the things we offer, many of the things, not totally inclusive. And now we're able to offer another alternative, the plant-based therapeutics, which I will talk about today. So my team is excellent, and we are all here for the betterment of our patients and our community. We all work really, really hard to make sure everybody gets what they need in order to take care of their particular problem and to get better and function better at a higher level and age a little bit more optimally to be able to do more as you get older. This is our clinic space. I have a heavy emphasis on physical medicine here, so my physical therapy team is very integral to my plans and how I treat people and empower people to get better and take care of themselves. You could think of the human body as sort of a beautiful natural machine, and if you don't take care of it properly, of course it's going to break down, and we kind of give you the ability to take care of yourself, but we're always here for bigger problems. Okay, so back to our topic. So medical marijuana, this is pretty much the new hot trendy topic. It's been around for years and years. I recently started doing it this year. And you know, I've done CBD and natural medicine and I've treated pain forever, of course. But now that the political environment is a little bit more forgiving and accepting of medical marijuana, I feel more comfortable now offering it. But it is an awesome alternative for people with chronic pain, particularly if you don't want opioids, which are, in my opinion, way more devastating to people and have way more side effects and are way more costly in the long run. So I think for people that don't want to be on narcotics or want to reduce narcotic usage, this is an awesome alternative for pain management. So what is it? So I get asked a lot of questions and I'll kind of answer them as I go through the slides from my patients. So one of the first questions is, what is this marijuana thing that I'm hearing about? So basically marijuana is just a word used when talking about cannabis sativa. So cannabis is a plant that's really been around on the planet since before we were. And you can essentially take the buds and the flowers from the plant, from the female plant, and then use it to create medicinal products. So pain relief to support the inflammatory or inflammation cascade in your body and make it a little bit more beneficial to you and less damaging. And then some mood altering benefits. So like it can control anxiety. It can help people that are feeling tense and, and it actually helps with sleep. That's one of the primary benefits I've seen with this particular form of medication. And you may or may not be aware, but sleep is one of the best ways and really something that should be mandatory in your health regimen. Sleep is the time when your body detoxes itself, when your body repairs, when you cement memories, when the brain heals itself. So if you're not getting good sleep, by definition, you can't be healthy. So marijuana helps some people that have chronic insomnia as well, and that in turn treats pain. There's different ways to take marijuana. You don't have to smoke it. Smoking is still linked to cancer, and marijuana is just a different way to put carcinogens in, just like the tobacco leaf. So smoking's not the best way to do this. You can do it in tinctures, gummies, there's vaping, there's inhalers. All of these are highly regulated with medical marijuana, and you get exactly what you think you're gonna get when you take it. And those are the preferred forms. So in Louisiana, it's actually illegal to provide medical marijuana in a smoking form, but inhalers and vaping is legal. And the psychoactive element of the cannabis plant is delta-9 tetrahydrocannabinol, or THC. So that's the term that links it to the psychoactive aspect of marijuana, THC. So what is the difference between marijuana and CBD? That's the other question I get a lot. So medical marijuana, again, it's going to be your natural legal method for plant-based pain management. In my state, Louisiana, it got legalized really a while back, but just recently became easier to do and less, it's still very highly regulated, but it's a little bit easier to offer it to patients now, and it's easier for patients to get it. CBD is cannabidiol. That is a non-psychoactive aspect of the cannabis plant. So the only psychoactive component, or what quote unquote gets people stoned or high, is THC. Cannabidiol, CBD, is actually an extremely healthy phytochemical that has no psychoactive components whatsoever. It is non-mind altering, but it's massively healthy for people. I'm a huge fan of CBD and what it can do for human health. And so you can have a cannabis plant that has high THC, low CBD, high CBD, low THC, or a mix of the two. And they're bred different ways for different purposes. So CBD is just another natural solution to control inflammation and reduce pain, but it is totally OTC, over the counter. It does not need a recommendation. Okay, so here we go, CBD. It is from what's called the industrial hemp plant. So industrial hemp is the cannabis plant that has been bred to have extremely low levels of THC. To be a USDA legally recognized crop that doesn't get burned and destroyed, it has to be less than 0.3% THC. And so CBD is highly regulated. If you get your CBD from a company that has third-party testing and gets it from an FDA and USDA approved farm and facility, then you can be pretty much guaranteed there's little to no THC in it. THC, on the other hand, is bred for higher THC content, or the marijuana is, the cannabis sativa plant. And so THC to date, even though it's legal, and we'll talk about where it's legal and how it's legal in most states now, is still considered to be a Schedule I drug with the likes of heroin by the federal government. So that means that they believe that it has no medicinal indications. They believe that it has a high abuse potential, and they still consider it a felony to possess it, even though in most states it isn't, and no one enforces that really at this point. Oh, okay. Part of today's talk, to make it a little more fun, we're going to give away a bottle of our CBD soft gels for those of you interested in perhaps trying the CBD, which again is the non-psychoactive component, but extremely good for you. And we're going to talk about how it's good for you in a minute. And here's how. So what has been recently discovered that I was not taught in medical school and still is taught in less than 13 or 10% of medical schools to date, 2021, is the endocannabinoid system. So interestingly, this is probably one of the most important systems in the human body, and most physicians have no idea about it or what it is. It is a regulatory unifying system. I think of it in terms of like the background software running all of your computer operations that makes it all linked together and work well. That's what this system does. So it works with the hormonal system, the neurological system, the musculoskeletal, skin, the GI system, so on and so forth. And it sort of balances everything. So everything in the human body is about balance. So too little of something is often just as bad for you as too much of something. The human body likes it right in the middle, and the endocannabinoid system keeps things there. So it's the unifying system. And doesn't that surprise you that we're not taught about it? And still, it's mind-blowing to me because this is massively important to human health. CB1 receptors are part of this system. So every system has ligands, or the little proteins that run around that link to receptors. And then the receptors cause action in a cell. So the endocannabinoid system has its own receptors, and it has its own ligands, or keys to the receptor. CB1 and CB2 are the most well-known of these receptors. And these are all over the body. In fact, they're ubiquitous. They're everywhere in the human body and in very large numbers. CB1 is primarily in the brain. CB2 primarily immune system. That's sort of the general way we categorize it. Of course, that's not a perfect categorization, but think of it that way. The cannabinoids, or the active compounds, the phytochemicals of the cannabis sativa, or the medical marijuana plant, hit these CB1 receptors in the brain, you see in the slide here, and that's how they're able to affect their mood-altering effects. The CBD does not hit the brain really to any great degree whatsoever, and that's how it's not psychoactive. We have a question.
Can you take CBD if you're on other prescription meds?
Question is, can you take CBD if you're on other prescription medications? Of course, I have to have a disclaimer and say, ask your prescribing physician, but I will tell you that the only contraindication for taking CBD with other meds is if they use the same liver enzyme for processing. And you can find these lists all over the internet. But you would have to take such massive doses of CBD to really affect the behavior of another medication. I just don't see how people would take that much CBD. So in my opinion, when I talk to my patients, I pretty much let them take CBD no matter what they're on. But if they're ever confused or they have concerns with a particular drug that I didn't prescribe, I usually have them call that doctor and talk to that doctor. But don't forget, most doctors don't know anything about the endocannabinoid system or CBD. So it's kind of a catch-22. But you can take it with other meds. You just need to make sure that they don't use the exact same receptor for processing. Okay, so the human endocannabinoid system, we sort of already talked about this, so I'm not going to get into it too much. But just think about this. THC is CB1, CBD is CB2. Okay, THC is brain and mood and pain, and CBD is immune system, regulatory functions, and also pain, and also a great antioxidant. Okay, so this picture I put in from another talk I gave before on CBD. I love this picture because it sort of gives you a glimpse of the awesomeness that is the human body. That is just simply part of a single cell membrane. The purple blebs, I guess, sitting on the membrane are receptors, and the green things are the ligands. So the purple would be the endocannabinoid receptor, and the little green guy coming in to dock at that receptor is the phytochemical or the endocannabinoid, which is what we make. So that's either going to be anandamide or it's going to be THC docking, right? So that's how it works. Then when it docks, it causes a conformational change in the shape of the receptor in the membrane, and different ions go in and out, different things happen, different protein signaling happen, and a lot of action occurs just from putting the key in that lock. And that's basically how the human body works at all times. This is going on billions of times per second throughout the human body for a variety of reasons, obviously. So we have discovered this system, I would say probably within the past 20, 30 years. But we now know that this system is millions of years old. It has evolved with the planet and with us. It's the same system we see in leeches, mollusks, fish, birds, and mammals. So it's in the most primitive of organisms and the most complex of organisms. Again, never taught in medical school. Extremely important for the normal function of bodies. So again, why are we not taught about this? I mean, I've had to teach myself, read everything I can find, do my own research, watch any lectures I can find. So I basically created my own school for this, if you will, because we weren't taught it, and obviously it's massively important. Phytocannabinoids bind to the same receptors as endocannabinoids. This is the same way opioids work. We have a system in our body, the mu, kappa, delta opioid receptors. And then the opioids or the semi-synthetics or the synthetics are able to bind to the same receptors for our own innate morphine-like substances. So we make endorphins and enkephalins and different pain proteins ourselves. Well, all the opioids are massively powerful synthetic versions of that to hit the same receptors. So this is another innate human system that plants have a substance that attaches to it and affects human action. Next. So how does this work? What is the change that happens with the receptor? I'm not going to get too into this, but it's fairly important. So when the receptor gets activated, it inhibits the conversion of ATP, which is our primary energy form, to cyclic AMP. Cyclic AMP is one of the biggest second messengers in the human body, and it is hugely important for the innate immune system's functionality. So if you inhibit the conversion to cyclic AMP, you can completely regulate how the innate immune system works. It's very, very important. And CBD makes your immune system work better. It has interactions with ion channels. So you may have heard of voltage-gated sodium channels, voltage-gated calcium channels. That's how Neurontin or gabapentin works in a similar way here. And it's what's called a G protein coupled receptor, which is the most common receptor in the human brain, and CB1 is one of them. 1,000 to 2,000 of these are known to date, and I'm sure more will be discovered in the future. And again, CB1, G protein coupled receptor, is the most common receptor in the brain. So it's just astounding to me that we're only now starting to really get into researching this. So the endocannabinoids, that's what you and I make in our body. So endo just means inside. So the endocannabinoids that we make are amplified by phytocannabinoids. So anandamide, the so-called bliss molecule that Dr. Meshulam in Tel Aviv discovered, is how CBD works. So CBD upregulates the amount of our endocannabinoid anandamide by downregulating the enzyme that breaks it down. So these products are made on an ongoing basis as needed in the human body. They're used and they're immediately broken down and gotten rid of. So it's like on-demand supply chain for the human body to regulate itself. Well, most of us are endocannabinoid deficient due to chronic inflammation, oxidative stress, poor diet, what have you. So the reason phytocannabinoids help us is they give us what we really need to regulate our own system because we're lacking it. So CBD inhibits the fatty acid amide hydrolase enzyme and upregulates the anandamide, and that's how it works. And then THC acts a little bit more directly. It will actually link to the receptors, the CB1 receptor itself. And then CBD just increases our own personal human-made endocannabinoids. So it regulates all of these systems on the right of the slide. So basically everything. So just name a system, the endocannabinoid system is involved in regulating it and balancing it. So pain control specifically, let's talk about that. So the cannabinoids will presynaptically inhibit glutamate release. Glutamate is an excitatory protein, so it makes nerves jumpy, firing. This is the source of a lot of neuropathic pain, so like diabetic neuropathy, sciatica, some of the fibromyalgia type pain. So what the cannabinoids do is they act on, I guess you could think of it in a similar way as a lot of the medications out there like Lyrica and Neurontin, because it inhibits the excitatory protein, which is glutamate. And again, that's integral to neuropathic pain. All neuropathic pain means is it's pain coming directly from the nerve. So like versus if you got punched or sliced with a knife, right? That's true tissue damage. That's a different kind of pain, somatic pain. Nerve pain is the nerve itself is firing in a dysfunctional manner. And then this other system, the NMDA, that's a big receptor system like CNS, PNS control, central nervous system, peripheral nervous system. Regulates that. And so through regulating the NMDA system, which is a little bit more on the CNS, central nervous system side, you can actually reduce migraines and the pain associated with fibromyalgia. Fibromyalgia is actually just one entity on a long continuum of disorders that we call central sensitization syndromes. So what that means is your central nervous system and your peripheral nervous system are upregulated. They're very hyper, they're very taut, they're very tight, and they're very responsive and jumpy. And so people feel pain with stimuli they shouldn't feel pain with. They feel pain longer and they feel pain more intensely. So the cannabinoids will also block capsaicin-induced hyperalgesia. What is that? Capsaicin is red pepper, think of it that way, or hot pepper. That is that burning element. So capsaicin hits a particular type of a receptor that induces that sense of heat and hot, and cannabinoids can block that. So it'll block, they work almost the same way as like I guess the capsaicin gel you might put on, but without the annoying feature of the capsaicin gels where there's this massive release of all of the neurotransmitters, and you actually have worse pain for a brief moment before it starts working. CBD is a little bit more gentle than that. The other beautiful thing I love about CBD is how antioxidant it is. So it's actually more powerful in terms of reducing oxidative stress in the brain and the body than vitamin C or E, which is tocopherol, so that's vitamin E. And then CBD is awesome in diseases and disorders like MS and rheumatoid because it inhibits the production or the actions of tumor necrosis factor alpha, which is one of the primary inflammatory cytokines that causes all these problems. So remember, I told you CBD attaches to the receptors in the immune system or affects the receptors in the immune system. This is one of the ways it does that. And then you can actually even count on cannabis products to reduce skin inflammation and skin edema by massive amounts because of the reduction of oxidative stress, the reduction of hyperinflammatory response, and the reduction of chronic inflammation because it balances the inflammatory response. Most of these skin issues are because of hyperinflammation of one sort or another, from one cytokine or another. And CBD and cannabis and marijuana allow us to sort of regulate it all and calm it down. CBD is being looked at heavily right now for neuroprotection, for brain protection. This is very big in the football and other head injury worlds because it helps you cope with oxidative stress in the brain. We're now starting to realize that a lot of our neurodegenerative disorders like Alzheimer's, Parkinson's, et cetera, is really from chronic oxidative stress, chronic inflammation damaging the brain over time. CBD seems to have a lot of innate properties at the basic science level and at the receptor level. Again, here's a picture of the cell membrane with receptors that actually will reduce the oxidative stress. So it does it through a few ways. It helps the mitochondria function at a higher level, which is your energy producers in the cell. It reduces the excitotoxicity of the neurons. We talked about the reduction in the glutamate activity. It reduces protein aggregation, which a lot of people attribute that to be the source of Alzheimer's. It reduces iron accumulation, so heavy metal kind of accumulation over time from our polluted water that we drink and polluted environment we live in, et cetera. It'll actually help detox that. And then it upregulates our own enzymes in the body that act as antioxidants. So this one in particular I mentioned here is the copper zinc superoxide dismutase enzyme. It upregulates it, and that gives you even more endogenous, meaning internal, defenses against oxidative stress in the brain. So I talked about how it works then, so the endocannabinoid system and how CBD differs from marijuana and how they kind of both interplay with that system. So you might be asking yourself, well, why is this illegal anyway? Great question. It was actually legal and used as a prescription, as it has been since time began in this country until 1937. So doctors used to prescribe tinctures of marijuana for things like premenstrual syndrome, pain, chronic pain, migraines, et cetera. And then for a variety of reasons that you can go research on your own, some political, some not political, it was made illegal with the Tax Act in 1937. Believe it or not, back at this time, the American Medical Association actually lobbied to try to keep cannabis legal because it was so effective for patients. And it had such low abuse potential and it had so many benefits. The AMA was actually working with Republicans in Congress at this time who also wanted to keep it legal, but they were not in power. The Democrats at that time, the New Deal Democrats, they wanted to mold individual health behaviors with central rules and central regulation, and the Marijuana Tax Act achieved that goal. So by making marijuana so expensive with this massive tax they lobbied onto it, they effectively made it illegal, even though it wasn't illegal. So that was the Tax Act, and then more acts came after that to make it even more illegal, and for a variety of reasons. The history is actually really, really interesting. If you're ever interested, you should just go start reading about it. It's fascinating. The very first arrest was a weed dealer in Colorado. So that's why it's illegal. Basically, probably it doesn't make any sense to you anymore after that slide, just like it doesn't make any sense to me why it was made illegal, but it was. So it is what it is. So now where are we today? So today, this is a recent Pew Research survey, fewer than 10% of adults believe that marijuana should not be legal for any reason. So that's amazing. 90% of American adults go one way or the other. And then this other slide just shows you what groups based on this survey results. So, take it or leave it if you believe surveys. It shows you that sort of how the world has changed. So now most people actually really believe in it for medical reasons, and even a lot of people believe in it for recreational reasons. So things are changing, probably for the better, because it does have a lot of really awesome health benefits. So in many states, Recreational use is still illegal. So like, you can go to the grocery store and get a bottle of beer. Well, you couldn't in the prohibition, right? Well, it's still illegal to go to the grocery store and get a bag of buds, I guess. But some states it is legal. Most states it's not. For medical marijuana, which is legal in the majority of states, you still have to have a recommendation, obviously, from a physician. And then you have to also be able to establish proof of residency in that state to go to one of the certified pharmacies. So it's still pretty hyper-regulated, which is probably a good thing because, like I said, we're only just now really getting into the research of all of this. So there's still a lot to learn. So 36 states, and maybe more than that right now, because every day when I wake up and read the newspaper, somebody else has made it legal. But like I said, the majority of states have medical marijuana now, and a lot of states have legalized recreational marijuana now. And then every state has CBD because CBD is not illegal anymore, and you're not allowed to inhibit interstate commerce with it. Here's a list of the states that have medical marijuana. And you may or may not be in a state with one of them. So how did that come about? Well, like a lot of things that happen in our country, it started in California. 1996, California passed this Proposition 215 based on a cannabis buyers club work. So they were getting cannabis in for people sick and dying from HIV and AIDS. So this was back when HIV and AIDS was really kind of a big thing before it was now what it is today, which is a totally treatable event. And once they did that, then a few other states in the surrounding region did the same thing and made it legal for certain situations. And then, like I said, now some 36 to 40 states or more have it legal. And 20%, think about that, 1 in 5 people in this country live in a state with legalized, fully legal marijuana. So the Dallas Buyers Club, I don't know if anybody remembers this movie, same concept. It's just these small groups of people with really bad health problems needed alternatives because modern medicine was failing them completely, and marijuana was one of those alternatives. And it brought it to us. And so recently in my state, like literally recently, August of 2020, they finally passed a law that gives the bank and credit unions the ability to serve cannabis businesses. This has been one of the big holdbacks because the feds still call it Schedule 1. Banks are not allowed to work with drug dealers. So you can't work with a cannabis business if it's still Schedule 1. Well, in this state, our governor just passed a law that allows them to. So now if you own a cannabis business like a dispensary, you don't have to keep all the money in a cash stash and try to get where you're going to get without getting jumped or hijacked or mugged. I mean, the whole thing has been sort of ridiculous. So we just did that, and they passed legal protection for physicians, which was one of my primary concerns because obviously I don't ever want to lose my medical license, but I think this plant-based therapy is awesome and it has a lot of health benefits. So I've been kind of waiting for the climate to be such that it's a little bit safer for physicians to do this for people. And then in our state now, they even changed the law, easier for doctors to recommend it to patients. Really, if a doctor thinks you need it for any condition now, it's pretty much okay. You just have to validate it and document it and prove it in your medical record. Excuse me. So why push for plant-based pain relief? Don't we have awesome pharmaceutical companies in this country that make amazing chemicals in labs? Well, first of all, don't forget, almost all of our drugs are made in China. 90% of the pharmaceutical ingredients of almost every pill you take is made in China today. Hopefully that'll change, but it's not looking so good for us right now. So this is just an alternative, homegrown, US-made, plant-based therapies. It's an awesome alternative, I think. Most traditional chemical pain relief comes with negative side effects. Every year, the FDA pulls something like 5% of the drugs they've approved off the market because of side effects they figured out later. So just because something's FDA approved and it's made by a big brand name company doesn't necessarily mean it's awesome, because they have a lot of really bad side effects. And you probably have read the package inserts from your prescription meds and realize this. So medical marijuana and CBD are in the world of natural medicine, which really there's almost no side effects. I'm not saying there aren't any because we're going to list a few, but it's just generally natural medicine is way safer than chemical, synthetic, factory-made medicine. Now, someone out there is going to be upset that I said that. It's a general thought process. Obviously, for some conditions, you need prescription meds. Of course, I prescribe prescription meds all the time. I'm just saying this is an alternative, and this is why it's being pushed all over the world, really. Our country has a particular problem of the opioid epidemic. So our country is like 5% of the human population on this planet, but we take like 90% of all narcotics. So we kind of have an issue with our, I guess, inability to cope or whatever. I don't know what's going on in this country, but we have a true opioid epidemic. This is a way for physicians to help people get off of those terrible drugs. Now, next slide. Look where I live. So the pink states, or salmon, whatever color that is, show you where the heaviest dispensing of narcotics is to date. And I'm in one of the heaviest states. So for whatever reason, Louisiana, people still love to write a lot of narcotic prescriptions, and people still take a lot of narcotics. So I am no fan of narcotics. I think they're devastating to people and families, and they do very little good except for short-term surgical relief. So I was thrilled when medical marijuana kind of hit the scene to give people an alternative for true chronic pain conditions. So why would a doctor recommend marijuana, you might ask yourself? I kind of told you a reason already. Patient benefit with few side effects. Now, I will tell you this, you need to monitor people on marijuana, and you need to start very low dose and increase very slowly if you need to increase, and kind of keep an eye on the side effect profile. You obviously don't want someone going to a dispensary and just getting the highest dose amount and taking it all at once. So if you take it appropriately, it's few side effects. The real reason is to reduce the use of narcotics, hopefully, over time, and therefore to reduce the risk of addiction and death from narcotics and opioids. The slide on the right side here, it shows you how bad this problem is and how it's only getting worse. So in 2018, there were 67,300 direct overdose deaths from opioids. And then this past year, it's 81,000. So we have probably, I don't think, made a lot of progress in this opioid epidemic state of emergency that we've been trying to fight this problem. So I think medical marijuana is an obvious reason or choice to use to try to help people get off of this. And that's an incredible number of dead people from getting addicted to narcotics. So is it right for you? That's another question I get asked. Well, is it good for me? Do you think I should take it? If you have chronic inflammation, true ongoing chronic non-malignant pain, meaning it's not caused by cancer, yes. If you have cancer pain, yes. So one of the best indications for this is chronic cancer pain. But there are a lot of reasons people have chronic ongoing pain, like the autoimmune disorders we talked about, fibromyalgia, diabetic neuropathy, and what have you. And then some people just have what we call in medicine intractable pain, meaning pain that no matter what you do, it never seems to go away or get better. And so medical marijuana is a good alternative for that group of people, because those people really don't have a good alternative. And a lot of people really don't want to take narcotics because of the heavy side effects on the brain and the rest of the body. So medical marijuana has been indicated for a variety of conditions. We're going to go into it in the next slide. But basically, it balances your pain regulating system and reduces the excitatory impulses from the nerves. We have a question? Oh, sorry. So basically, you can get treatment without the negative side effects. So what are the side effects of the pain meds we do now? I'll tell you real quick a couple of them. Narcotics not only cause addiction and death, but they actually cause hypogonadism, which nobody tells anybody about. So if you're a guy, you'll have less testosterone if you're taking narcotics. And if you're a woman, you'll have less estrogen. Well, that's a whole host of problems, obviously. And then anti-inflammatories have a massively high amount of GI bleeds and ulcers as a side effect, in addition to the cardiac side effects associated with anti-inflammatories. So everything has a bad side effect. Marijuana has a couple, and I'm gonna get into them, but as long as you keep your dose at a reasonable level, you probably won't have them. But again, this all needs to be physician monitored and regulated, really. So these are the qualifying conditions. But again, I told you Louisiana kind of changed the law. Really, if you have intractable pain or any reason a physician thinks you need it. So let's say you have one of these endocannabinoid deficiency syndromes, you would probably be a great candidate for medical marijuana because it's natural. You don't have to take a lot of it. It's a great alternative to narcotics, and it doesn't have the side effects of the Neurontins, the Lyricas, the Celebrexes, the ibuprofens. and the narcotics that we're all aware of. So what do we use it for generally? In my practice, because I treat, I'm an orthopedic surgeon, but I also do a lot of wellness-based therapy. So my practice, it's a lot of diabetic neuropathy, people with fibromyalgia and myositis, like muscle-based pain, anything musculoskeletal, autoimmune disorders like rheumatoid arthritis, lupus, things like that. But look, there's a whole host of neurologic issues you can use it for, like MS, that causes a lot of pain because that's a chronic inflammatory disorder of the brain. PTSD, I'm a military veteran, and there's a lot of research going on for use of medical marijuana and CBD for PTSD. Parkinson's disease is a great indication for it, and then anxiety, high levels of anxiety. Even CBD has been shown to reduce anxiety. So to date, we think that it's pretty safe. It's very self-titratable, so you gotta work with a patient one-on-one and with the pharmacy to sort of get the right dose for that person, for their metabolism, and how their liver processes things. And then it's relatively inexpensive. I will tell you, it's not cheap and it's not covered by insurance. But when you look at the potential side effects and medical costs of these other drugs to treat pain, I think it really probably is going to ultimately prove itself to be the cheapest option. And again, most of it's made here in America, which is also a good thing. And it could help us to reduce the use of narcotics, which I think if we did that in this country, a lot of our societal problems would be solved. So are there side effects of medical marijuana? Well, of course. There's side effects of breathing oxygen if you do that too much. But the side effects of medical marijuana are really a big deal in kids. So I personally don't think anybody with a developing brain should be taking medical marijuana unless they have a really solid indication for it, like epileptic seizures or something like that. And that's something you'd have to go see a physician about. But the brain develops up till age 25, and you can really cause major problems with the developing brain, particularly if someone's genetically prone to mental health disorders like schizophrenia or whatever. You can actually induce a psychotic break in a young person. So I think probably that's a group that should shy away from this. But depending on how much you're taking and your level of overall health and your hydration level, et cetera, you can cause dizziness. It's been known to increase the heart rate. It can cause low blood pressure, which in some people can be a problem. Now, in some people, that might help their high blood pressure. It can cause red or bloodshot eyes, and then mood changes, as we discussed. So there are some psychological issues that you need to think about. So if you're considering this for chronic neuropathic pain or whatever, really the key is to have a physician guiding you, go to a reputable pharmacy, which you really can't do anything other than that right now legally, and start with low dosing and just kind of titrate it to effect and avoid these side effects.
Someone just wanted to know about RA. Does it help with RA? You had mentioned that.
Somebody asked if it helps with RA, which is rheumatoid arthritis. Yes, absolutely.
Somebody was also, again, advocating for us to return the human soul effort.
Oh, okay. Next slide. All right. So if you're really into reading about side effects, the CDC, of course, has provided you a lovely list of them. And here's the site. You can go to the CDC and find that. I will tell you there's still a little bit of data out there that shows that people can get addicted to this and get what's called poor motivational syndrome or lack of motivation. So some people on marijuana lose their sense of motivation in life. 1 in 10, the CDC thinks will get addicted. 1 in 6 if used before age 18. So again, I think the younger age set should really be guided by a physician, and it should be a real true indication that would help them more than hurt them. And then a lot of the side effects that have been noted in the literature are heart and lung side effects. Well, if you read the literature a little bit more critically, you'll find that a lot of that is because this is smoked cannabis that they're looking at in those studies. So again, you shouldn't ever burn leaves and then inhale the smoke. By definition, that makes no sense. But for some reason, people still do that. If you're going to do medical marijuana, I would do the tincture, the gummy, or some other much safer form. And again, there is a risk of developing temporary psychosis, particularly if you are prone to such things. And then a lot of people maybe have heard of paranoia as a side effect. That's kind of what I'm talking about. No, it's vaping. Louisiana made vaping legal recently, not smoking. We can fact check that, but pretty sure. Next slide.
Could this be the possibility for this nerve pain that comes and goes in my foot and leg?
We had a question of from somebody asking if they would be a candidate for medical marijuana for pain, nerve pain in the leg and foot that comes and goes. So that's neuropathic pain, it sounds like. And again, that is one of the primary indications for medical marijuana. So I think so if you have intractable neuropathic pain that's failed other modalities of treatment, I think you would definitely be a candidate. So in our state and in most places, to get medical marijuana, you have to be professionally evaluated by a physician, and then you receive your recommendation, and then you have to go to a certified pharmacy which sells a regulated product. So it's actually a good thing because you know that you're getting a safe product that's been tested and it's not mixed with adulterants. It's not going to have like synthetic marijuana in it with all of those crazy side effects. So the medical professional, a physician like myself, will evaluate your condition, what meds you're on, your history of medications, your other treatments to treat the pain. Are you doing anything else? And hopefully guide you into other ways to empower yourself to get better. And it's really important to be honest when you have this visit with a physician, because otherwise we won't have any idea how to dose this. So you really need to kind of oh, geez. All right, hold on. Okay, so here, so I actually went through the whole educational process and licensing process in Louisiana before they changed the law and made it a little bit easier. So I am fully certified. I have a medical marijuana permit, the whole deal. And obviously I stay up on the research and read about this. So if you came to see me, I would meet with you, do an exam, talk with you, get your history. If I needed relevant medical records from somewhere else, I will run, before I see anybody even for this, we run your name through the database that tells us all of the narcotic and controlled substances you've received from any physician. And we have the ability to look at Louisiana and some of the surrounding states. And so I'll look at that and see what your current morphine daily equivalent is, and hopefully be able to help you modify that and reduce it if it's too high. And there's certain levels we look for and consider too high. And then once we go through all of that process and I decide that yes, so-and-so would be a great candidate for medical marijuana, then I make my recommendation. And it's pretty much that simple. I kind of say what I think the person should start with, and then I send it to the local pharmacy that's certified. Here in Baton Rouge, it's Capital Wellness. There's one in New Orleans, there's one in Shreveport, and I think there's one in Lafayette. And then they have an appointment. So the pharmacist there will meet with the person that I've made a recommendation saying, yeah, I think this person might be a good candidate for this. And then they kind of talk to them too, and between the three of us come up with a workable plan for the therapy. And then we just do close follow-up. I mean, I don't think anybody should be left out in the woods with this with no guidance. So I try to see people every 2 months and make sure they're not having side effects, that they should keep a pain journal and a dosing journal so we kind of can start to get a feel for what really does actually work for that person, for their condition, in their environment, with their diet and et cetera, their metabolism. And then over time, hopefully we get optimized and get it just right for people. So it's very early in the world of medical marijuana nationally. And a lot of us are kind of learning as we go. The papers are being written right now. The studies are being done right now. But we're part of that process. And I think it's an important additive, if you will, to what we're allowed to offer people to make their lives better. And so that's why I do it. And hopefully I can get people that are on narcotics off of them, because I think this is a much safer alternative. Okay, I'm going to answer a couple questions now.
Medical marijuana is very costly. Why is recreational marijuana so much less expensive?
Somebody just asked, why is medical marijuana more expensive than recreational marijuana? Well, like most things that are regulated and taxed, it's more expensive than things that are unregulated and untaxed. Recreational marijuana is not regulated, except that it's completely illegal in this state, and it is not taxed. Medical marijuana is highly regulated, tested for purity, tested for impurities, tested for bacteria, heavy metals. It's also tested for the level of THC. So you get a true pure product and know exactly what you're getting. That's a very expensive process. And then the state taxes it. So that adds to the cost. So that's why it's still cheaper in most states to get marijuana on the black market, but it's also still illegal in most states to do that.
We have, in South Carolina, I don't think marijuana is legal. How does one find a reputable CBD provider? We have many advertising, but I'm just not sure.
So somebody in South Carolina just asked about CBD because I guess medical marijuana is not legal there yet. So they're asking about CBD and how do you make sure you have a reputable CBD provider? Well, so I have a CBD product through my natural medicine product line that we have, the Well Theory. And the way we keep it reputable is we use an American factory to make it. It's from a USDA regulated farm is where they get their primary ingredients. So it starts out regulated and legal. The place where it's made is an FDA regulated facility, and then they third party test it, and then we third party test it. So basically it's tested for heavy metals, pesticides, microorganisms, for THC content and CBD content. And so it's, again, a whole process of making this as good a product as possible. So you just need to make sure it's third party tested. Most places will provide what's called a certificate of analysis that you can look at and see if in fact you are getting a good product.
How long, Vicky wants to know how long generally does it take for CBD oil to make a difference in neuropathy? She does not have diabetic.
So somebody asked a question of how long should one expect to wait before they feel an effect from CBD oil for neuropathy? Well, it's a good question because like I said, the research is ongoing. Everybody is a little bit different and require different levels of dosing. So for instance, our product, the soft gels have 25 milligrams of CBD and each dropper of the oil has 25 milligrams of CBD. Well, some people do great with a single dropper or a single soft gel. Some people take 2 or 3. For pain. It just depends. And the other thing that's important to remember about natural medicine is, again, this isn't stuff that's synthetically manufactured by mixing chemicals in a petri dish and a Bunsen burner in a lab. So it's a much more gentle effect on the human body. And a lot of people, you don't really even notice an effect until you notice that problem anymore. I don't know if that makes sense, but you're not going to get this massive immediate pain relief with euphoria like you do with Norco or Vicodin. It'll take months and months and months sometimes, but eventually you'll just feel better, you'll be healthier and have less pain. The dosing, you just kind of have to modulate and sort of test yourself. Like, so for a month, take 1 dropper, and then the next month, take 2 droppers a day, or do it every couple weeks. But none of this has an immediate overnight effect. No natural medicine does. Oh, yeah. One of the primary reasons to take CBD, and a lot of people, again, for THC, is to improve sleep. So perhaps if you're just starting out and the neuroprotective effects and the antioxidant effects, I would take it at night, and then that side effect's beneficial. We have another question. All right. All right, well, hopefully that gave you sort of an overview of how this works, why perhaps you haven't heard of it before, why it was illegal to begin with, why it's legal now, why do doctors even recommend it, and how it might help you. I think I hit all of the questions that I get asked most often by my patients. But I think it's been a wonderful addition to the world of medicine. I think it's making us better doctors and better able to treat people with these difficult problems that impact their lives. And so hopefully this will go with everything else I do and make people function better in their lives, do more, interact more with friends and families, be more productive, and just generally be happier is my goal.
Anna wrote in, she uses the multivitamin we have for CBD and the herbal immunity, and it's helped.
Okay, was that? A question? Oh, a shout. Anna just gave us a lovely compliment, but not a question, sorry. She takes the CBD multi and then the herbal immunity. The herbal immunity is pretty awesome because it's got things like echinacea and elderberry, so it pumps up your immune system. And then CBD, as we already talked about, also pumps up your innate immune system. And then the multi has vitamin C, zinc, and D3, which are also good for your immune system, which you probably think of immune system as really it only functions to fight viruses and bacteria. Well, really, the immune system is the key to everything in your life, because anytime you get injured, anytime there's a mutated cell, anytime something goes wrong inside your body, it is the immune system that heals it and fixes it. So for my purposes as a surgeon and a doctor, I want people to have the best immune system they can possibly have, whether or not it's just good for healing and for living well. All right. Well, hopefully that answered your questions. And obviously I'm here for anybody that's a state resident of Louisiana for a consultation. But just look around where you live, and I'm sure there's a provider that can work with you if you think you're a candidate, which it sounds like a lot of you out there are, which is not uncommon. There's a lot of people with very difficult health problems in this country, and hopefully we can help you. And this is one of the ways we can do it for you. One more question.
Why do you add vitamin C if CBD is better than vitamin C?
Why do I add vitamin C? Because you still need vitamin C. It's integral cofactor to a lot of processes in the cell. CBD is just a more powerful antioxidant than vitamin C in general, but like most things in the body, you can't just have one thing, one substance. So like minerals, like you need selenium, but you need zinc, but you need magnesium. So CBD is a massively powerful antioxidant. That's why I take it, because I want to have good brain health when I get older. But I also take a ton of vitamin C because it's been shown to be integral to the innate immune system as well, and for the function of the neutrophils when they go in and hit the bacteria and the damaged cells from injury at the first stage. And then also it prevents that so-called cytokine storm. So really, you should be on every different antioxidant you can think of. You should eat every different type of berry out there or colored fruit and vegetable, because each of them has a role.
Everybody said thank you. Hoping the nervous system will help.
All right, thank you. Somebody out there said they're hoping the nervous system multi helps. I think it will. I designed the nervous system multi for that neuropathic pain problem we talked about too, for also the problem of the drugs. I hate the drugs that we prescribe for neuropathic pain because the side effects are so terrible for people. But we have very limited options in this country to treat pain that stems from the nerves, with like sciatica, diabetic, neuropathy, chemotherapy-induced neuropathy. I mean, there's a million reasons to have nerve pain. This one has natural substances that promote new nerve growth, nerve regeneration, reduce nerve inflammation, and reduce oxidative stress in the nervous system. So I take it every day for optimal brain health as I get older. But I think it's definitely going to help people with neuropathic pain, in addition to things like medical marijuana. Oh, someone wants to know what the nervous system multi is. It's here. It's on the right of this slide. Basically, it has different natural substances that have heavy amounts of literature supporting their use at the basic science level for nerve health, like resveratrol, which is what the ingredient in red wine that makes red wine so healthy for people. Resveratrol is actually a nootrope. It actually helps nerve cells grow. Has green algae in it, which is a superfood that detoxes heavy metals out of the system. Has N-acetylcysteine, which is used for a lot of nerve-related disorders. It has PEA, palmitoyl ethanolamide, which is in that family of fatty acids like anandamide, the bliss molecule we talked about, and a couple other ingredients that all work together to make the nervous system more effective in general. And omega-3 fatty acids, which I left out of this talk, but massively important to nerve health.
Everybody's really excited. Thank you.
All right, we're going to sign off. Go enjoy your day. And if you think you're a candidate, I'm here for you. We can at least talk about it. I mean, I think it's a great thing. And I do think the price will drop over time. Right now, it's just probably overtaxed. I think that eventually that will change as it becomes more commonplace, probably. Will what?
Will the video be available?
Oh, will this video be available? Sure, yes. We post all our videos. On the Facebook page?
Facebook, websites, all of the websites.
Okay, all of the websites. So the Well Theory website, the Healing Soul website, and my practice website, Warner Orthopedics. So it'll be available for you. Because like I said, from a line of teachers, it's what I like to do. So we'll see you next month.